everybody. Joining me now to talk a little about something that affects a lot of people out there, Dr. Richard Habighorst from Habighorst Chiropractic, and he's here to talk about something called restless leg syndrome. Good morning.
Good morning, Amy.
So I've heard about it. What is it exactly?
Restless leg syndrome is it's a restlessness in the legs. It's caused from nerves that are damaged. And people that have restless leg syndrome, the legs just are restless. Later in the day, into the evening, they just don't know where to put them. It causes them to lose sleep. They wake up at night. They have to move around, get around, and it's very uncomfortable. And because they lose sleep, they just they lack energy the next day, because they wake up so often through the evening.
What are some of the symptoms? How do you know if it might be you that has this? I know a lot of people suffer from it.
Some of the symptoms can be a numbness or a tingling, but mainly just this creepiness, this crawliness of the legs. They just don't want to sit still.
Mm-hmm. And at night, I know, like you say, sometimes it affects your sleeping, and which is, during the holidays, we all need a good night's sleep. So, the legs just continuing to move. Is that pretty much what it is?
They continue to move, and the only way that people try to stop it is by getting up and moving around. And it's to try to get a good night's sleep and rest and have to move around. It doesn't mix.
Doesn't work at all. How is this something that runs in the family, or who would be susceptible of getting something like this?
There are several groups of people that get this. It can run in the family. It can also be there because of other conditions, maybe pregnancy, a deficiency in iron, or other chronic conditions like diabetes.
Now, you are a chiropractor, so I think when people think chiropractor, you think, back, neck pain, but you do so much more than that. How can you help if somebody's at home suffering from this right now? What do you do?
What I do in my office, a patient will, they'll complete a questionnaire. It's called a restless leg subjective questionnaire, and then we'll do some very specific testing on their legs and feet to identify small nerve fiber neuropathy. And neuropathy is damaged nerves, and we're able to test these nerves, find out how bad they are, and then with this information, if they're a candidate for our care, we treat them using a multimodal approach, including co-laser light therapy. We have this right here. It's a type of light therapy that energizes nerves and helps nerves to heal. The drugs that people typically take for this type of condition don't help the nerves to heal. They mask the symptoms, and our type of treatment actually helps these nerves to heal. So it's a safe, non-invasive way of helping people.
And tell us some of the results. One of the I guess success stories.
Probably the best case that I had was a woman that had to get her sleep. She worked 12-hour shifts, and she would only get 1 or 2 hours of sleep a night. And after the program of treating, she had to use an alarm clock to wake up in the morning. She could sleep a full 7-8 hours of sleep, and she had to use the alarm clock to wake up. It was cool. She was just excited about finally being able to get some rest, and she hadn't been able to rest like that for years.
Very, very cool. So if you have what we're talking about, maybe you know someone who does, doctor can help. Dr. Richard Habighorst, thanks so much for coming. Appreciate it.
Thanks, Amy.